Welcome to Adventures in Surgical Weight Loss with Dr. R. I'm Dr. Richard Rasmussen. I'm a bariatric surgeon and excited to bring you another story from a surgical weight loss patient. My goal is to give patients a place where they can share their amazing stories. I get to hear these stories all the time. I hope through this process to get rid of some of the bad information that exists about surgical weight loss. Today we get to hear the story of Brad Whitcomb. Brad's had a lot of success and he's had some bumps in the road, and he's a nurse and kind of understands the medical field and definitely went in eyes wide open, and it wasn't necessarily a smooth road, but he's had some great success. So I'm excited for you to hear his story. Today I have the opportunity to sit down with Brad Whitcomb. Welcome, Brad.
Hi.
All right. Why don't you go ahead and tell us your story?
Okay. So, ever since I was probably about 10 years old, I was a little bit of a hefty kid. I'm originally from California, San Francisco area. When I was about 14 or 15, all throughout my youth, I was very active. I was very lean, tall for my age. And then when I was about 14 or so is when my weight really got out of control. During PE, at school, I broke my ankle in 3 places, and I was in a full leg cast for a little bit over a year. And then it was a bad break. And then I was in a half leg cast, or to the knee cast for about another 5 months after that. So it just really torched and ruined, decimated my metabolism. Unfortunately, I was still an athlete, and so I still kind of used to my eating habits, and where just shove it all in, eat as much as you want, don't have to worry about anything. And my weight just skyrocketed. I have been on several different medications, several different nutritional diets, Weight Watchers, Slim Fast, Jenny Craig. None of those really seem to work for the long haul. They would help for a little while, some more successful than others, of course. Let's see, what else? When I was around 17, I had a lot of depression, and leading up to that. So not only am I very open about my weight loss journey, I'm very open about my mental and emotional health. When I was around 17, I attempted suicide. And after that, or leading up to it, I had become bulimic. And so I lost about 50 or so pounds in about the span of a week and a half to 2 weeks. And my brother noticed, who I shared a room with, and he basically threatened me to tell my parents if I didn't stop. And so I did. But before it really got out of control, where I needed medical or clinical assistance to stop that unhealthy habit. I let's see. I went on a mission for the LDS Church, and before that, I had gotten down to about 280 pounds, because before I even sent my papers in to apply or request to go on a mission, because I knew that they would probably tell me that I needed to lose weight beforehand, so that way I was as healthy as I could be in order to accomplish the physical requirements that a mission needs. And that was not done in the healthiest way. I also don't really fully understand how I did it. I was working 2.5 full-time jobs, and I was on the activities committee, and very much integrated into my congregation or my ward at the time. So there was a lot going on, very little sleep, lots of just around everywhere. I was also working summer sales as a pest control person in a bank and a movie theater at night. So yeah, I was working myself to death. That's probably how it happened. But then I came back and I had ballooned back up. Even though I tried the hardest I could, I was a seminary teacher working at Applebee's at night. I was working at a private college, the California Maritime Academy in Vallejo, California. I was working there. So again, two jobs in California. Seminary teacher is not a job. It's a volunteer effort. But I was working myself a lot. But then it wasn't working. I wasn't losing weight. I was just gaining. Um, I met my wife, and I had when I was about 31. And I hired a personal trainer where I would be working out with him about 4 to 5 times a week. And I lost some weight down to about 320 pounds at that point. Um, and I was feeling really good. I was in shape. It wasn't just like the adipose or fat tissue that had fallen off. It was actual muscle gains and things like that. I was very actually healthy. Um,
Now, I'm going
and
to interrupt for just a second. You've told us kind of some where you dropped down to. Where were your highs in all of this?
yeah, so my highest was 450 pounds. And uh, that was probably about 6 months or so before I came in to consult with you for the surgical weight loss. I had gone to my primary care provider. I told him what I wanted to do, and he said, "Well, let's try to lose some weight first. Doing this and that." So I just felt like I hadn't been listened to or heard. But I went home and I tried my best, and I got down to about 380, which is where I believe I originally checked in with you at. So it was a process.
And so back at this point where you got down to 320, and you felt like you were doing pretty well health wise, what had been your high at that point?
My high at that point was like 430, 400, something like that. I think it's so long ago. Trying to remember. I think it was about 420 when I first started with my personal trainer. Um, I think that was about it, if I remember right. Um, Throughout the years, just with my weight fluctuating so much, I knew also that that wasn't good for my cardiovascular system or my heart. Um, so I ultimately made the choice to come and see you, Dr. Rasmussen.
So
Um,
so take me through that part of the journey. I mean, you finally felt like, okay, I'm at a point. I need to do something more than what I've been doing. You went to your primary care doc, and it sounds like you were a little frustrated because you were now ready to make a decision, and they kind of said, go back and do the same stuff you've been doing.
yeah, so and I don't want to paint my primary care doctor as like the villain or anything like that, but he said, let's try this one last time and then we can go about that. So he was willing to work with me. He just wanted to give it one last shot with checking in with him weekly and things like that, actually doing like a medical assisted weight loss and like seeing a nutritionist and things. So he did want to try something new that I had not done before, but it was a little bit frustrating. So he ultimately was willing to work with me.
That's good. He was willing to work with you, and quite honestly, that aspect of a time of medically supervised weight loss. Some insurances actually require it, but especially coming up to surgery, any changes that people are making, any kind of dedication and honing in, those are all helpful. So you kind of hit the ground running. when we start doing the surgery stuff. So
Right.
so at least there's the silver lining in that.
Right. And since the last time or when I first started, the whole process, it has changed since then. What insurance requires and different insurances require different things. Mine at the time had required me to meet with my primary care and have it notated that I was meeting with him for weight loss. Then I could meet with you, and then I had to meet with a dietitian, a psychiatrist, or therapist, um, and a physical therapist. And then I had to go back to see my primary care physician. Then I had to go back to you. So there was a lot of doctor's appointments to really try and jump through hoops. That's what it is. I was jumping through hoops at that point because I couldn't afford to do out of pocket pay. Also, something I should probably include because you obviously know, but I am a nurse. I work in surgical services, and that's how I first met you, Dr. Rasmussen. And when you had started doing these procedures, I watched and I listened and I learned. And ultimately, I came home and I told my wife, I was like, hey, I'm thinking about doing this. What do you think? And she is really supportive. And I think I couldn't have done it without like the support of my wife and getting into your office and getting to the point that we actually had the surgery. And then your staff is so amazing that they really have made the whole journey after, well, leading up to it as smooth as possible. Because, like I said, lots of hoops, but they were very held my hand every step of the way. They had very bullet pointed things that really helped. Okay, I do this, then I do this, then I do this. Very clear steps. And then afterwards, just, I mean, your nurse practitioners and your front desk staff and just your surgical weight loss organizer or um, coordinator is just all amazing. They really love and care about each individual. They know me by name before I even show up. So it's very a personal touch, which makes it feel like they're in the journey with you.
Oh, that's awesome. And I appreciate those comments. I mean, we have worked hard to create a culture that is very supportive for patients.
Yeah.
Um, During that process, you show up, you mentioned some of the things you have to go through, and then we get up to surgery. Is there any point in that where you said, I don't know, maybe I really don't want to do this?
Actually, no. So that's the kind of the unfair advantage that I had as being a surgical nurse is I work in the prep and the recovery. So I got to see a lot of behind the curtain. Sorry, but I was really gung ho. I said, this is what's going to work. I know it's going to work. This is what it's going to like. I already knew the dedication and the lifestyle changes that were going to have to remain a permanent fixture throughout my life. And I was gung ho, man. I was all in. I was not any sort of wishy washy. I really pursued it. I was excited for it. Um, so that's kind of, I guess, the advantage that I had. Whereas um, I don't know if the correct term, the lay person or the person that's not in the medical field would not have. But I would say don't question, just do it.
And what I love about that is, bringing that perspective. if there, if there are concerns about the difficult aspects of it, you're the type of person that's going to know that, right? You're going to see all of that. And so to have that type of confidence, I think is very helpful for those who don't have that opportunity to see behind the curtain, as you said. So I think that's a great perspective.
Yeah. I'm super huge on communication too. So if you ever have, I always tell like, so we have students that come through, like nursing students or med students or just people, new grads or new nurses to the profession. And I always tell them the only stupid question is one that goes unasked. Seriously. And I've always lived my life by that. So if I ever have a question or if anybody that's listening ever has a question leading up to this, up to the actual surgical date, just ask. Like, don't be prideful. Don't think that, oh, they're going to think less of me because they don't. Like, nobody thinks less of you. They're always going to be willing to explain to you exactly what's needed, what's going to happen, what you can expect. or side effects that could possibly happen. So just ask, just make sure that you keep that line of communication open, and everybody's going to be totally willing to help you through their entire process.
Yeah, that's awesome. So why don't you jump forward now and kind of tell us what you've accomplished through this journey?
Well, so excuse me. So everybody now has known that I was at a max of about 450 at one point, and then when I started the surgical weight loss, I believe the day that if I remember correctly, or at least what I always tell people, is the day of my surgery, I weighed 378 pounds on the day of my surgery. That's my weigh in when I checked in for pre-surgical prep. Um, Not sure if that's really historically accurate. I could check the medical records, but I'm pretty sure that that's what it was. Um, so on the day of my surgery, everything went great. My coworkers were fantastic. They treated me just like anybody else. You know, we laugh, we joke, we try to take that ease off of the patients, try and take that anxiety out of the question. I like to think of myself as the nurse, the Patch Adams of nursing, as you well know, Dr. Rasmussen. Um, but so going for surgery, I had a surgery. Everything went fantastic. I mean, I wasn't awake during it, but afterwards, I was upstairs. I was drinking my water and my chicken broth and wondering, okay, here we go. I knew it was the rest of my life. Like, it felt like there was so much leading up to it, so much checks and balances. And then afterwards, I felt like I could finally just take a deep breath, like, oh, it's over. And this is the new. This is the new normal. This is the rest of my life. And I felt like I was staring at just new possibilities. And it was just really kind of exciting. I like new challenges. I like feeling like I have a fresh start. Um, I felt like all those mistakes in the past, all those, dietary things, everything that had happened in the past was just in the past. This is my fresh start. This is why I get to prove to everybody that I'm not what my body portrayed. I am more than that. And a fresh start is what I needed. And so I'm in the hospital. I think I stayed only one night. You were open to me staying 2 nights, but I just wanted to go home. So stereotypical.
I was just going to say most of our patients do spend one night, and
Yeah.
most people want to sleep in their own bed as soon as they can. It's just more comfortable, and you don't have people coming in and waking you up in the middle of the night. So
Yep. Yep. And I think that's exactly what it was too. And that I just wanted to go home. I wanted the IV out. I just wanted to be in my own space. I was done with coworkers seeing different parts of me that I never wanted them to see. I, that was one challenge. Um, so I learned from a previous surgery on my tonsils that I developed something from anesthesia where I can't urinate for a long period of time. So I had a Foley catheter and they had to take that out. And so there was just parts of me that I wanted to kind of keep private. And so I was like, I'm ready to go. Just let me go home. But so there was that. But that was one of like those things that I just had to get out of my head. Like, stop thinking about it. Like, they're just doing the job. You're just another patient. They're not. Yeah. Anyways, but sometimes I still see coworkers in the cafeteria. They're like, "Hey, how's it going?" Once they finally recognize who I am because I look so different. Pictures to follow. Um, but yeah, so I went home. I had amazing help from my wife. She's absolutely phenomenal. I I did do something very stupid, so stupid. Dr. Rasmussen always sorry, this is kind of weird talking to you in the third person. He or fourth person, I guess that is. he all kept saying, "So you're going to take a month off work. So 1 month off work, 1 month. We'll see you in about a month back at work." And I kept rebuttaling him and saying, "So 2 weeks, because I only have PTO or paid time off for 2 weeks. 2 weeks. I'll be back in 2 weeks." I was back at work in 2 weeks and I was miserable. It was so horrible. Take what is suggested by medical professionals off from work. Um, yeah, my coworkers, it was rough. I think the first shift I worked only like 3 or 4 hours and then I went home. The next shift I worked half a shift. And then the third shift, I think I worked the full one. It was rough. Don't
Do
just,
you work eights or 12s?
I work 3 12-hour shifts.
So I
So,
think it's important for that perspective too, right? Because we have patients who have a desk job and they
yes.
can get back pretty quick, but you're on your feet all day. It's a 12-hour shift. Now there's a little different perspective there.
Truth, very true. If you, I was in school too I was doing my bachelor's of science for nursing online. And don't be surprised, I would say, if you can't sit up, like at a desk job for more than like maybe an hour. I had to build back up my tolerance for it. Um, So it was very interesting trying to write papers in like 30-minute increments and then having to go lay down for a while and then coming back and then having to go lay down for a while. But you will get your tolerance back, but you have to build it back up. So, yeah. So also, I guess I never even said it. The type of procedure that I had was the Roux-en-Y. I don't think we covered that yet, which procedure it was, but I had the Roux-en-Y procedure. So I had um, well, I'll let you educate them about that.
Well, so gastric bypass is the common terminology for it, but Roux-en-Y helps distinguish specifically, and Um, typically we use that, and I'm not remembering your history specifically, but typically we use that either for reflux or type 2 diabetes. And so that's usually where that one comes into play.
Yeah. And I had like acid reflux. So one of those things, also one of those hoops that you have to jump through is you need to get an EGD. Normally, if you have any sort of acid reflux history, to make sure that that you're a good candidate for which type of procedure. Forgot to say that was one of the hoops I jumped through. Um, So I've been doing good. About 6 weeks, I had a really hard time, which Dr. Rasmussen knows, after surgery. I don't know if it's attributed to me going back to work too early or not, but um,
I think it was bad luck. It was the nurse curse.
the nurse curse, where anything or some things that are very obscurely that could be a side effects or a challenge for you to get over could be happening to you. So I do have the nurse curse with every uh, aspect of my health, which is sad. But I developed what they call a stricture in my anastomosis, the new exit from my pouch that goes into my small intestine. So it had strictured off and closed down to where I couldn't have this gastric or the stomach emptying. So I always felt nauseous. I couldn't really keep things down. I vomiting all the time, kind of like pregnant ladies do when it's called hyperemesis. Um, yeah, it was horrible. And I was walking around work with an IV in my arm because I was so dehydrated. And I went in for my 6 week follow up. And I will always remember this. I will go in for my 6 week follow up, and Dr. Rasmussen said, "So, how's it going?" And I tell him, and he's like, "Oh, why didn't you call us?" Because I was a prideful nurse. I didn't want to think that, "Oh, Brad, you're just being like a hypochondriac. You're fine. This is expected." I wanted to suck it up. It was my pride, and I was dumb. I should have called. That's what I'm talking about. Your staff are absolutely amazing. They're always willing to just answer any question. And I was not living by my motto and asking the question that I was being stupid. Um, So you said, let's get you in to see the gastroenterologist. I went in, I got an EGD by Dr. Chad Calla, who's absolutely amazing. He put a stent in and opened it up. So the stent is like a little tube or that stayed in that exit, that anastomosis, to help keep it open while the swelling went down, things like that. 6 weeks after that, I went in for another checkup with Dr. Calla or another procedure. It's called a esophageal gastroduodenal, an EGD for short. That word's like 30 something letters long. Um, but so I had another EGD. The stent looked great. Everything was fantastic. I did have a marginal ulcer.
How do you
Uh,
remove the stents at that point?
Well, the stent had naturally passed, so it's small enough. The stents are small enough that once it becomes loose, it can travel through your bowel, and then you just poop it out. And no, I did not see it. It's so small that you would have to go through your stuff with a fine tooth comb to find it. And I no, mm-mm. They don't want it back. Don't do it. It's not needed. Just flush. Um, but let's see. So I had a marginal ulcer, went on the recheck, which he just put me on some medication called Carafate. I took that 4 times a day and my ulcer went away. I've had 2 other ulcers since then. Just I attribute to stress of my life or my work or whatever. But each time I just go back on Carafate for a while and then I'm fine after that. But I am doing well now. And
Let me just clarify a couple of things. So, marginal ulcer is the terminology, and you mentioned, I think, before it's where your gastric pouch attaches to. It's the same place you had the stricture. It's where the gastric pouch attaches to the small intestine, and it happens in about 16% of patients. The most common reasons for it to happen are smoking and using NSAID, so ibuprofen, Aleve, those kinds of things. But like yourself, even in individuals who don't have those 2 risk factors, they still can get marginal ulcers. And so, if you're having symptoms, obviously be evaluated so that can be treated. Are you on a proton pump inhibitor regularly?
no, I'm not actually. I was on 2 different proton pump inhibitors, which are also known as the lay term would be acid reducers. So I was on 2 of those before my surgery, but ever since then I haven't had to take them. And so yeah, I don't have any acid reflux or anything like that. I've gone in to be rechecked with another EGD to make sure that I don't have any gastritis or inflammation of my esophagus, and everything looks fantastic. I'm like picture perfect.
Awesome.
So,
Love it.
go ahead.
I was just going to say, I appreciate you sharing that. There was definitely a bump in the road. I think you had one other significant bump in the road.
I did. And this is the other thing, the other piece of advice that I would have to say is listen. Oh, okay. So everybody that has this procedure, you become so intimately knowledgeable about your body and your GI tract. You know best. You know your own body, what is normal, what your new normal is, what your bowel habits are, what they should look like. You learn to pay attention to your body so much better than you ever did before. Um, I was at work one day and well, no, before that, I woke up and I had some pain. I didn't understand what was wrong. I was like, maybe it's hunger pains or something. I don't know. So I got up, got finished getting dressed and all that jazz, got ready for the day, went to work, and the pain just was still there throughout the whole time. That was on a Wednesday. Um, and they let me have the day off the next day. And so I could recuperate, whatever. And Thursday, I ended up going to the ER and they said, "Oh, you just have IBS." I was like, "I've had IBS before." And I was like, "This is not IBS." They sent me home with an anti-spasmodic and they said, "Just take this, you'll be fine." I was like, "This is not IBS." But I took it. I went home. I don't think I never even took the medication. I never even took it. I knew it wasn't IBS, which listen to your doctor. Yes, I shouldn't tell you not to listen to your doctor, but I knew it wasn't IBS in my case. And so I go to work on Friday. The pain is even worse. It's migrated, it's traveling, it's becoming like a bigger area in my abdomen. I struggle through the day. They let me go home like 3 or so hours early. I struggle all through the weekends. Oh, so I talked with one of the doctors in the hallway. French benefit of my work is I always have access to doctors. I talked to one of the general surgeons in the hallway. He said, "It sounds like you might have another ulcer." I'm like, "It's not an ulcer. I've had that before. It's not an ulcer." But they plan to do an EGD with Dr. Kawa again on Monday, who was on vacation. We text him and he said, "Yeah, add him on Monday." This is a fringe benefit. I totally am pampered and spoiled. I know that. Doctors not as easily to get a hold of. I understand, but their offices are. Call their office, talk to their staff, and yes. Anyways, so they plan to do another AGD on Monday. I struggle all through the weekend. It's getting worse. I go in on Monday to the ER. I'm like, I can't take this anymore. It's like 2 or 3 a.m. And I go in the morning, like midnight, whatever, middle of the night, I mean. And I go into the ER and I tell them something's wrong. I don't know. You're the doctor. You can figure it out, but something's wrong. It's not IBS. Figure it out, please. And they knew that something was wrong when I'm saying, I don't want certain pain medications. I don't want the big ones because they make me feel weird. But could you give me this instead, which is IV Tylenol? And he said, I know you're not drug seeking when you're asking for IV Tylenol. I get that. I'm, yeah, because that's I'm always worried about. I don't want to go into the ER or go to my work and be like, can you give me some pain meds? Like, I don't want to be the drug seeking nurse, the nurse Jackie from that TV show. But the doctor really listened to me and he said, I understand something's wrong. We're going to figure it out. Let me call the general surgeon and see what he thinks. It was the same one that I talked to in the hallway with. And he said, Dr. Rasmussen is here today. Let me talk to him and see what he would like to do. And you being super responsive, you said, I think I know exactly what it is. And you took me in, we did surgery. And I give you full permission to disclose exactly what you found.
Well, you ended up having an internal hernia, and so your intestine had twisted through an open space, and that was cutting off the blood supply to it and kinking it, which was causing the pain. And so we were able to untwist it and then close up that hole that it had slipped through to prevent it from happening again. I'm trying to remember. I'm pretty sure I looked at your CAT scan. Do you remember? Was there something on there that I said, "Oh yeah, I think this is what's going on"?
Um, I don't remember it. Like, so I had the CT, I had an ultrasound, I had X-rays. They did the full workup in the ER, and
Did you have a
think
second CT on Monday?
so. I think I had CT on Monday as well. I had two CTs. I'm pretty sure they did CT on Thursday and then the CT on Monday. I think it was an increased fluid in the abdomen that you said.
What if I'm remembering this correctly? What it was is your anastomosis of your small intestine had moved.
Oh,
So it was like, oh, this is not where it should be. And having those two kind of back to back so close, I could see that, this is significantly different location than where it was a couple of days ago, and your symptoms had significantly escalated. And I think
yeah.
that's what really kind of pushed me to say, yeah, pretty certain this is what's going on, which is why we went to the operating room.
Yep. And Dr. Rasmussen, I trust. So then I spent 2 days in the hospital, went home, and I've been fine ever since. Yeah.
So I love you sharing those things. I think it's important for patients or prospective patients to understand that it's not all roses, right? I mean,
Mhm.
there's difficulties to this. There's things that can happen. There's complications that can happen, and there's often bumps along the road. But they're typically manageable, and we can get people through them and help. And so maybe to highlight what's the benefit of going through all of that, why don't you share with everybody how much you've lost and maybe even some of your non-scale victories.
Yeah. So scale victories. Sorry. Frog in my throat. Scale victories would be that at my lowest, so I gained a little bit of weight back, which is very common, normal occurrence. Don't worry if you gain a little bit of weight back. But during the process, I would plateau. Also, don't worry if you plateau a couple times. Just keep on the track, keep on the game plan, and your body will adjust, and then you'll start to lose weight some more. But the lowest I got, which is when I got the common cold or the flu, um, I got down to 172. But right now I'm sitting at around 220, um, which I try not to focus too much on the scale and more on how I feel. I went through this operation and this whole lifestyle change. Because I was in chronic pain. I had severe back problems, knee problems, hip issues. I had 7 bulging discs in my back, which those don't go away, but they get better. Um, and now, non-scale achievements are about 2 years ago, uh, I chose out of the blue. I don't know what prompted me to do it, but I said to myself, I need to do something that can prove to myself that I can drive myself, without anybody else being the wind in my sails. I need to do something that I can do and put a pin in myself that I have the drive and the ambition to do it. So I signed up for the St. George Marathon. And the month before the St. George Marathon, which happens in October, the very first Saturday in October, I got shin splints. So after almost 7 months of training, I got shin splints right the month before at the beginning of September. I took a whole month off of training to try to let those heal, to get like those back, make those go away. About 3 days before the race, I got sick, like the common cold. And so I was congested. I wasn't breathing well. The race is on a Saturday, and um, Thursday night, I said, I'm going. I'm going. My wife and my boys were sick, and we had a condo already booked down there, like Airbnb. And my in-laws were sick, so they weren't going to come either. My boys and my wife stayed up north, and I traveled down to St. George by myself. I stayed in the townhouse by myself. I got I picked up my packet Friday afternoon. I drove down Friday morning, got there Friday afternoon, picked up my race packet myself, did all of it myself, and I think that's really what I needed. I needed that to raise my self esteem, to know that while, yes, I have all these people behind me, yes, I have all these supporters behind me to help me and encourage me, it only comes down to me, myself, my feet, my legs, and the pavement. And it is such a power of will to do that. I ended up finishing 15 of the 26.2 miles, um, until my shin splints got so bad that I could not continue. They kicked back in around mile 10. At the 13.1 mile marker is the half marathon. So I did more than a half marathon. And I've always lived my life also by another motto that why shoot for the moon and only make it to space when you could shoot for the stars and make it to the moon? If you miss the moon, you might make it to the stars. So I shot for the stars. I said, I'm not doing a half marathon. I've never done a half marathon before, but I'm going to shoot for the full marathon. I made it to the moon. So,
Well, congratulations. That's awesome. That's a feat not a lot of people have been able to do.
yeah, thank you. I have signed up for the St. George Marathon again this year. I'm not quitting. I am going to do a marathon at some point in my life.
That's fantastic.
So if you can have one of your nurses cover my shift the first weekend of October, that'd be great. No, just kidding. So yeah, I am. I would say that, like I said before, this is the fresh start, and it's your fresh start. This is your chance to write your story for yourself. You have full control over it, and I don't want to go back to the prequel. This is my fresh novel. So I'm going to write it myself.
That's awesome. That's awesome. Well, I really love what you shared with us. Any last bit of advice you give anybody listening to this?
Let me think. There's going to be so many people that say, do this, do that, try this recipe, only eat in this style, only eat in this way, only have this, like, don't eat this, blah, 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 or whatever. And you can listen to them, you can take their advice, but it's your job to apply it. It's your option. If you don't think it's going to work for you because of lifestyle or your own GI tract, you know that you can't eat that or whatever, it doesn't agree with you, then don't. But you have to find what works for you, and you're in control. If you succeed or if you fail, it's your choice. It's your decision. Ultimately, it comes down to you.
Thanks. That's great advice, and I'd just maybe addend to that. It is that tool, right? It's using that tool, and we tell patients this all the time. If you use it correctly, it'll work for you.
Yep.
If you don't use it correctly, it's not going to work. So yeah, it's there's that commitment, and you want to make sure you're ready to make that commitment. But if you are, here's a tool that'll help you be successful.
Right. Yep. Exactly. And Dr. Rasmussen's like a great asset to have in your corner throughout this whole procedure, this whole process.
Very kind. Well, thank you. I really appreciate you taking the time to share your story with us, and I know it'll inspire a lot of people.
Thank you. I appreciate you so much. You've changed my life. I appreciate it.
Yeah, you're very welcome. I've been a piece of it. You've changed your life, but I've been able to help you with it.
It takes a team.
Yeah.
So thank you.
Thanks again to Brad Whitcomb for sharing his story. I appreciated the vulnerability he showed in sharing some of the struggles he's had throughout his life, and then ultimately the success that he's been able to have, and really appreciate his time. Please take a moment to subscribe, rate, and review our podcast. It will help us reach more people with these amazing stories. I also have a YouTube channel where you can see this video, as well as several other videos about surgical weight loss, general surgery, and robotic surgery. Join us next time for another amazing story.
Resonate.